Good afternoon to you. My name is Simon Hooper, and I'm the co-founder of the world's first crypto healthcare platform. My background is pretty simple. I am an ex-geologist, but I spent 10 years watching my mother be cared for by carers, courtesy of NHS and surgical error. Bedbound and paralysed, her carers did their best, but to be honest, they failed to deliver person-centered care. They didn't have the time or the tech, and she suffered as a result. Her well-being suffered, and so since her death, I spent the last 10 years building technology that supports better carer and the person engagement. And let's look at some of the problems in care. I think we know most of them, to be honest. Carers are underpaid and under-respected. There's a lack of person-centered care for the person being cared for. And the world, well, it's getting older and increasing the cost burden on governments and families. And the result is an inadequate quality of life. So over the years of building tech and caring for my mother, I noticed some quite interesting phenomena. And the key one that stands out for me was that in the everyday world, we have a lot of phenomena that's not in the care sector. So basically, in care, there's no perks, no benefits, no rewards, no retail gains, and of course, no respect or little respect. But in the normal world, we get rewarded. We get air miles when we fly, we get tokens and discounts when we purchase. But why is it that when we do anything in the care world, we get none of these? So I started to look at building a new model for care that would correct these discrepancies. The model goes like this. Number one, build a community, because there's strength in community and increased security if you can have them be on a platform that you can manage. And we call this social engagement. Number two, provide free care apps that are integrated and easy to use and have a compatibility, if you like. These free care apps collect a data set that we call electronic life records that is all about the person. It's kind of like Facebook's data set, but used for care, to assist carers better know the person, to know what the person's interests are, to know what's happening in their local community that matches their interests and prompts their family and carers to achieve engagement within the community. And also provide entertainment and activities. For it's our view that if you're going to want to use tech to supply and support complex care needs, such as falls monitoring and medication adherence and so forth, the best way to do that is to achieve a sticky engagement with the person through their pleasure, their world of pleasure, the things they want to do, such as engage with the internet, shop, connect with the grandkids, entertainment. If you can achieve that daily engagement, then the rest is much easier. And of course, the big one is monetize care actions. What is a care action? Well, whenever we're caring for someone these days, much of it's done digitally, whether it's Zoom or Facebook or WhatsApp or Amazon, a lot of it's done digitally, and the data that is generated during that process is captured. So the first thing we do is we convert digital care actions to tokens. So we do this by building apps that mimic what we're using. We have our own replacement for Zoom, we have our own replacement for Amazon, and so on and so forth. And we award tokens to members when they undertake a care action to support a family member or a neighbor or someone in the community. And those tokens have value. We can also capture data and have that be monetized to the value of the individual. And then, of course, when you shop on Amazon, you get nothing for it. You tell your friends about the products you've bought, you get nothing for it. But in the ReMe market, you're rewarded for engagement, for promotion, for purchasing, repeat purchasing. And lastly, because of the very nature of the model, we share in business growth. If the community builds itself, if a member of the community makes a referral or builds an increased care circle, then they're rewarded for it. So we monetize all those actions that when we're involved in care daily, we do naturally, but get little reward for. And of course, the only way we can do this is by using blockchain and crypto. And the end result is that we can generate a monthly passive income from doing those care things we do every day. So if I had time, I would tell you that we've built our own wallet, that we have built our own ERC20 token, that we're deploying Polygon, that we have a plan with regard to the metaverse. We have our own avatar, Bluey, and we've completed phase 1, and we are now raising funding for phase 2, which will be completed in 6 months. So ReMeLife is live as a crypto ecosystem, but will be continuing its development and growth over the coming months. So what is the result? What is the outcome of this rewards-based care model? Well, community engagement is for us huge, because we want people to get out, to engage with their community, with their neighbours, their carers, and to connect. And that brings massive rewards in terms of well-being, but also financially for local authorities and care organisations. And the other result, of course, is the impact on the person when it comes to having a sense of purpose and positive engagement. Our system is cross-generational, multicultural, and provides a trusted environment. And that generates well-being for the individual. And of course, lastly, this is a rewarded care model. And to be able to generate a passive monthly income from your care actions, from engaging in the community, is, well, novel to say the least, and socially significant. So we call the ecosystem, the ReMeLife Rewards-Based ecosystem, a careocracy. So I hope you've enjoyed hearing about the rewards-based care model. It's a social impact community that empowers people to self-manage their care and be rewarded for caring. And the good news is, after years of hard work during COVID, we're launching today. So you can become a member at ReMeLife.com, and you'll be kept up to date with the news as it progresses and the rewards as they become available. And should you want to, you can participate in supporting us with regard to our funding requirements via the ICO, the initial coin offering that will be launched in about 4 weeks' time. So thank you. I look forward to taking your questions.